to my second video. My name is Devin Pinkston. I am a gender therapist in Grand Junction, Colorado. I am also a mental health clinician just by trade. So today, the second video is a little bit about some frequently asked questions that I receive from clients who are coming in for gender therapy. So I have got a list of 4 questions that we will be going over today about gender therapy moving forward in a medical or surgical transition for transgender, gender nonconforming people. So let's get started. Let me pull up my list. Okay. So the first question that I have is, how long does it take before I can get on hormone replacement therapy? To answer this question, it really varies from person to person. For me in my practice, typically I will see people about 4 sessions before I feel confident moving them forward. And why I usually pick about 4 sessions, again it varies, is because that gives me enough time to see consistency and how people are responding in answers, getting information about mental health background, on major depression, any issues with anxiety, substance use, eating disorders, things of that nature. So about a month gives me time to figure out where somebody's at and to make sure this is what they want moving forward. This could vary from therapist to therapist though. Some might want you to come in for a little bit longer, some it might be even shorter. I try and operate from a stance of, if there's not a lot going on that we need to work with and you are only here to be seeking a letter of referral, great, let's get you moving forward as quickly as we can. In the state of Colorado, typically the therapists and the medical providers do work from an informed consent model. That means that you are aware of all of the pros and cons, so the benefits and the consequences of moving forward with a medical transition. So I definitely try and be that first stepping stone that people get when coming to therapy, knowing here are some of the things change-wise that you might be expecting if you are a trans male, for instance, or a trans female. Some of those changes for trans men could be an increase in body hair, increase in upper body strength. It could be also loss of fertility, things like that. So some of those things positive, some of those things maybe negative. For trans women, it could be softening of the skin, decrease in upper body strength, breast bud growths, so positive things that you're looking for. It could also be some issues with, if you haven't had lower surgery, issues with erectile functioning, testicular size, infertility as well. So kind of making sure that people know not only what are like the positive, happy things that they're looking to get changed, they read about online or from their friends, but also what are some of the realistic things that could be going on too. Let's see, I think there might be another part to this question as well. Oh, I did touch on the letter of recommendation. A lot of physicians, at least on the western slope of Colorado, do want patients to have undergone mental health therapy first, just to kind of make sure that they've been assessed for the things I mentioned earlier: major depression, major anxiety, substance use disorders, the gamut. Oftentimes the medical physicians, they're only looking for one thing or a few things of, I want to know your family, medical background, your medical background. Are you aware of these positive and negative consequences? Let's move you forward. So they don't get the opportunity all the time to assess for deeper issues that we would be able to go over in here. And a lot of them do really appreciate that we've gone over that when you come in to see me. So that way they know, oh, if this person has had issues with depression, these are things that maybe we need to look out for, or maybe this is where we need to start somebody dose-wise. So hopefully that answers that question for you guys. So the second one is, where can I go for top surgery if I live on the western slope? Well, you can actually stay right here in your own backyard. We have a physician that I work with, a surgeon who does top surgery for breast implants or mastectomies for breast reduction. He works in St. Mary's at Regenesis Plastic Surgery and Skin Care, so it's his own practice, just housed in the hospital here. So he and I have touched base one-on-one, and he's very friendly to the community. He has done quite a few mastectomies. I'm actually not sure if he's done very many breast implants for trans women, but in general, I mean, that's his thing. He does breast implants for cisgendered women, mastectomies, so breast reductions, and although he doesn't advertise directly on his website, he is somebody who I've trusted and I've sent quite a few clients over to. So if you want a little more information about any of the providers we're talking about in this video, just kind of as an aside, I do have a blog which I will post at the very end of this article that goes through all of the providers that I am currently aware of, and I do keep an active running list of people who are friendly to the community and people who you can seek out right here for a medical transition. I do also work with about 6 or 7 hormone therapy providers, so it's really just dependent on whether or not you're looking to use your insurance or go out of pay. So I try and direct people based on that. Alright, so number 3, can I use insurance to cover hormone therapy or surgery? And we kind of just touched on insurance just a little bit. So the answer is it varies. It's really going to be dependent on your own individual insurance plan, for one, and whether or not the insurance company in general will cover cost of hormone therapy or surgery. A good way to find out in the state of Colorado who is going to cover this insurance-wise would be going to One Colorado's website, and that's exactly what they're called, is One Colorado. They are a political lobbying organization across the state, so they've got organizers on the Front Range and on the Western Slope who help advocate basically for LGBTQ issues at the political level. But they maintain a list of active insurance people who will process hormone replacement therapy or surgery options. From what I know right now, as of 2017, now this could always change just based on the insurance company themselves and national policies that might change, but as of 2017, these are the insurance companies that I am aware of that will authorize hormone therapy or surgery, and that would be Cigna, Blue Cross Blue Shield, Rocky Mountain Health, and Medicaid. And I'm pretty sure there are a couple others that were listed on the One Colorado's transgender friendly insurance company list, but that's something that you'll want to definitely look into, and I can post a link to their website at the very end of this. It's really beneficial if you yourself, before you even start either therapy or any type of medical procedure, to call your insurance company just to say, hey, this is what I'm looking to do. Is this something that's covered under my policy? Do I need to take additional steps to make phone calls for pre-authorization, or is that something the medical providers do? Pre-authorization is just calling up the insurance company to say, hey, this is what I'm going for. Here's, like, usually the medical facilities will do this themselves, but sometimes they want you to do it, so they'll want to know, like, the billing information, what type of procedures you did, so that way they can authorize the diagnoses for the procedure or for the medication, which would be the hormone therapy. So definitely call. I know it sucks staying on hold all day trying to wait for somebody to pick up, especially with insurance companies, but it's something that can be very helpful, and it gives you that knowledge and power going in, knowing that yes, this is something that can be covered, and I am aware of how to kind of navigate this system myself. Alright, so the fourth and final question is, what can I expect to change with hormone replacement therapy, and when can I expect to see physical changes? Again, like I kind of said earlier with the insurance, it's going to vary from person to person, and whether or not you are older or younger, or whether you're going for testosterone or estrogen therapy. For a lot of trans males that I see, we go over in here some of the effects that they might see once they're on hormone replacement therapy, or how it's also referred to as cross-sex hormone therapy, which can include increase in body hair, increase in body odor, increase in upper body strength, redistribution of fat. So a lot of positive things that people are looking for. Also some of the side effects, other negative side effects too, which could be infertility issues, blood clotting, sometimes the increase in like body odor and sweating isn't a positive, so we go over all of that. For trans women, what we talk about is the skin softening like we mentioned earlier, the changes in body hair, so there might be a decrease in body hair or the thickness of it. There's a decrease in upper body strength. There's also, for some of the more maybe negative side effects that people might perceive, the increase in infertility, erectile dysfunction issues, decrease in testicular size if you haven't had any lower surgery yet, or gender conforming surgery is what it's also called. So I like to cover that in here with people so that way they kind of know going in. And then I also recommend they speak to their medical professional because they're going to give them much more information about what to expect with that type of treatment, whether it's surgery or hormone therapy related, because I am not the medical professional and they're going to have a lot of your background anyway on maybe you've got diabetes that you're working with, or maybe you have asthma, how that's also going to play in with all the changes. Typically, changes for hormone therapy take effect at about the 2 to 3 month mark. That's when you'll start to recognize, hey, I'm starting to see some of these positive things that I've wanted that make me feel more whole as a person. And I love when clients come back and tell me that, yes, I'm starting to see a change, or when I can start seeing that physical change in people. That, it makes my heart sing. Because that's part of my job, is to move people forward and make people feel whole, whether they're coming in for gender therapy or for something else entirely. For surgery, changes with that are going to be pretty immediate. Recovery time is going to be dependent upon your body type and different factors that might play into that. So that's something you'll want to talk to the surgeons about, whether you're going for top surgery or some type of lower surgery, especially hysterectomy too. Healing process is going to vary. So hopefully that answered a lot of your questions. Again, if you are somebody who is considering wanting to transition medically but just don't know where to start, I can be a great resource for you if you're in Grand Junction, Colorado, or even if you're somewhere else on the Western Slope. Get in touch with me and we can talk about how to make that happen, and I can get you connected to people who will be able to move you forward in that way. I offer a free 40-minute consultation for most new people when they come in, whether it's in person or we can do it over phone. I have worked with people all across the state of Colorado, mostly on the Western Slope, so we could definitely talk about how to get this going long distance as well, because I have connected people to physicians in their local areas. So don't feel like you're limited if you're not located directly in Grand Junction. We can still get you moving forward in a different way with people who are close to you. So if you like this video, please feel free to subscribe to my Facebook page. If it's not already on the Facebook page, if you're not finding it there, my Facebook page is Devin Pinkston, Gender Therapist. You can also find me on Twitter. My Twitter, @name is @IdentityInsight1. So it's identity and then insight is INSIGH, the number 1. And you can find me also on Instagram @loveyour_identity. Thanks so much for tuning in, everyone, and I look forward to doing another video.